I performed hand hygiene and I checked the patient's chart. I checked her pertinent medical history, any contraindications that can not let me push this antibiotic, and any history of allergies. And I'm also going to confirm again with the patient. So I came into the room. I'm checking the wristband, noting the name and date of birth, and asking for allergies. I have my medication on hand that I pulled up outside of the room. I made sure to perform my 3 checks, and we're going to go ahead and get started. So let me grab some gloves. Okay, we're going to put some gloves on. All right, I checked the name and date of birth and allergies. All right, so I'm just assessing the IV right now, looking for any signs of redness, erythema, or infiltration that might be present. And I'm not noting any of that right now. I'm going to go ahead and take off my Curo. There we go. Curo's off. We're going to be cleaning the site for about 15 to 20 seconds, just to make sure that it's sterile, it's clean. All right, and we have a flush here. Okay, just going to make sure I get all the bubbles out of my flush, and we're going to connect that. All right, sir, so I'm going to go ahead and push the saline. You might get a salty taste in your mouth. Just let me know if it's hurting, okay? Or you're feeling any pressure. So as I'm flushing, I'm just noting for any infiltration present, or if the arm starts to swell. Is there any pain with that? No? Okay, perfect. Okay, just finishing that up. I've made sure that my line is clear. And I'm going to be using this again, so we'll go ahead and just place that to the side. All right. Just to be sure, we'll be cleaning one more time, 15 to 20 seconds. Now we're going to be administering the Rocephin. So I know with Rocephin that I'm going to be pushing for about 5 minutes. So I'm going to go ahead and connect that. All right, so I'm going to go ahead and push for about 5 minutes, but I'm going to be noting if the patient has any reaction to the Rocephin, such as diarrhea, nausea, or vomiting. I'm also going to be checking for an allergic reaction, such as a rash or burning. All right. All right, are you feeling hot or a rash or any pain coming from this area? No? Okay, perfect. All right, so I've been pushing for about 5 minutes now. I'm just going to remove that, take my flush, and then we're going to be flushing the rest of the way. All right, here comes the flush. You might get a salty taste. All right, just making sure it's not infiltrating or anything. Perfect. Okay, that's all finished. We're going to do one more clean. Great. We're going to get our new Curo cap, and we're going to place that on the site. Okay. Perfect. The Curo cap is on. We're going to put that there. All right. So we're all finished. The patient tolerated it well. So I'm just going to be noting, I'm going to be charting my patient's reaction, how well they tolerated it, the medication that was administered, if there are any reactions. I'm also going to document the amount of the saline push that I pushed into my patient, and I will be monitoring for a reaction and coming back in about 15 to 30 minutes to reassess my patient. And I'm just going to remove my gloves and perform hand hygiene.